Good day, ladies and gentlemen. My name is Tsoeute, and I'm currently a student at the Cape Peninsula University of Technology, enrolled with the Department of Emergency Medical Sciences. The degree that I'm currently registered for is the Bachelor of Emergency Medical Care. And today, ladies and gentlemen, I will be presenting to you my research paper, and I hope you enjoy it. And it will be presented as follows. So starting off with the presentation, I would like to introduce my topic. So my topic basically looks or is going to look at or has looked at an analysis of the frequency of exposure of the emergency medical care student to the use of intraosseous access in the clinical emergency care setting. So we can start off by identifying the problem statement of the research itself. So basically, there was a need in this current topic that the researcher is discussing, and that there was limited research in terms of obviously identifying this, seeing that the insertion of the intraosseous access skill was a need to the EMC student by the end of their qualification for the HPCSA requirements, in order for them to be able to be deemed as competent, in order for them to go and be exposed, obviously, in the working environment after their degree. So it means that once they get to the clinical field, they become more exposed, obviously, to the skill itself, and obviously with the assistance of clinical facilitators that they work under supervision with, that obviously facilitates in making sure that these students actually gain access and obviously exposure to the skill itself. So in order for us to achieve this, we identify that we have to use a system called First Step in order for us to be able to gain the information, and obviously which is loaded and logged by the students themselves after their clinical experience, in order for them to keep this data as record of the exposure to the skill itself. Okay, so moving forward, we are going to discuss the research objectives of the research itself. So the research objectives, or rather the aims, were to determine the frequency of exposure of the emergency medical care student to the use of the IO access tool in the clinical settings. And it was to establish during which period, obviously, these skills were most likely to be acquired during their clinical or rather experiential learning. And then lastly was to determine the students, if whether the students are sufficiently or rather sufficiently exposed to the skill in order to meet the Health Professions Board's requirements. Okay. So some of the limitations that were actually encountered during the research in terms of gathering the information and obviously bringing across the research objectives themselves, is the fact that the only data that we could be able to acquire was, or we could rather use, or that was given rather, was information that was only for students who were registered for the Bachelor of Emergency Medical Care in 2019 and were registered for clinical practice as well during that year. And obviously the data included solely information from their previous years of study as well, from the time at which they started the degree. And no other year groups were involved in this, which is, I felt like it was a limitation that could have, for example, if there were more students that we used, could have actually let us gain more data and see if whether the students are quite in actual fact exposed to the skills. However, we couldn't fulfill that due to the fact that obviously it would have constrained time and would not have been able to finish in time with our research as well. And so that was basically the limitation that we had. And another thing is that we could not actually identify as to whether the device used was either manual or automated, but rather that was not really important. We just wanted to see as well how much exposure was the student getting, obviously, in the clinical setting. And lastly, as well, another thing that I'd like to mention is the fact that the limitation that we have is the fact that we couldn't actually identify as to where exactly the students were gaining more experience with these skills, in terms of whether they gain more skills from in hospital or rather from the out of hospital environment, which is we wanted to get that information in order for us to be able to place students, or rather to let the educators be able to place the students where needed, where they would obviously be exposed to a lot more skills in terms of being exposed. And the research design that was used and the methodologies that we used. So the source of data and the research tool that we gained the information from First Step Data, which is an online tool that is used in an electronic tool, which is used obviously to gather this information, and then obviously this information was sourced from that, and we're able to interpret the information. Then thereafter, obviously, the research tool, as mentioned, is a first step itself. So the data collection procedure that was used in collecting the information is the fact that this information was taken from First Step, and after it had been obtained from First Step, it was captured and then into an Excel spreadsheet, and then interpreted into demographic data for interpretation purposes, and then the data was analyzed, expressing the findings relating it to the outcomes as expected, obviously, within this research. And then obviously the data spans from 2015 up to end of 2019. Moving forward, these were the results. Also, rather, just to actually mention the research problem before we go to our results, is that we saw that, or rather, I saw that there's actually a great need for patients to gain immediate access to intravenous lines, or other ways in which they could get fluid administration or either drug administration, which is, or rather, prompt life-saving interventions, and more so for critically ill patients. So seeing the need that students were not as much exposed to the IO access versus the intravenous access, which is the standard which is currently used in our healthcare system mostly, versus the IO, is that this was best for me to address, in order for us to be able to advocate, or rather to let the system be aware, or the health system be aware, that this needs to be rather more advocated for, so that we can be able to stipulate, or rather put in the necessary changes and improve, or rather add the intra-osseous access device in our health system, in order obviously to reduce or rather improve chances of survival for our patients. And so obviously try to find ways in which we could intervene, and obviously where there is a lag that is obviously limiting us, or rather limiting the healthcare system in having this device at hand, obviously for all healthcare workers, in fact, and reduce that. Okay. So moving forward, based on our research methods and methodologies that we used, there were findings which were observed, is that skills that were observed is the fact that in 2019 there were more skills that were rather obtained, as we can see in this slide, speaking about the age distribution of patients in finding 1A, skills observed and performed from 2015 to 2019. There were more skills, and that were obtained in 2019 versus all the other previous years, and that we could actually see that the skills that were actually performed during that year period as well, 16 of those were performed, and there was like one skill which was attempted successfully, which was attempted twice, but all of them were actually attempted successfully. So as compared and versus all the other years previously. And then across the age distribution, we see that mostly it's actually the younger, or rather the infant and the neonates age group, which students tend to be rather more exposed to when it comes to being exposed to the skill itself. And lastly, we can see that based on our findings 3A, the skills required was actually an amount of 10 skills for the Department of Emergency Medical Sciences totals by the end of 2019. And then for the year itself, which is 2019 for the PMC 4 years, 4 skills were required of that. However, if we are looking at our expected results versus the obtained results, that 340 was at least expected from the 34 students if at least 10 was required from them. However, by 28 was the total which was received in overall, meaning that these students did not make the targets, and obviously did not achieve the targets which were expected from them during this time period. And then concluding our paper is the fact that based on these results is that we were trying to achieve as to where the students achieve more of their skills from, whether it was from in hospital or out of hospital. However, this could not be achieved based on the fact that it was a limitation. And then we were able to identify that these students obviously did not achieve these skills as required, meaning that there was a lack and there was a need, and there's obviously a role of contributing factors which have contributed to this, and obviously prohibited these students from gathering this information as required, or rather these skills. And we've identified obviously what needs to be improved in terms of trying to get this. Let the board sit down and come up with ideas as to how they can improve, or rather get funding, or rather how they can expose the students obviously at better sites to gain this experiential learning, and for them to be able to qualify as well. Okay, so the slide number 13 actually shows our list of references. And then I would like to acknowledge all my lecturers which were involved in this study, which is Dr. Navindra Naidu, who has left us in the department, and thanking Mr. Harrison for his major contribution in this paper, and making sure that it was written promptly and that everything was written as needed. And also thanking Mr. John Mayer for actually assisting us in terms of giving the data, and making sure obviously for all of them that this data was this paper was achieved. And then obviously the importance of the study was obviously to be able to let our lecturers be able to see as to where the need is and where the lack is in terms of placing these students at the appropriate sites, so that they could be able to allocate the students at appropriate sites in order for them to be able to achieve the required skills and be exposed as much as they need to, in order for them to be able to be deemed quite competent by the end of their degree, and to meet all the other objectives that were expected obviously of this paper. And I would like to thank everyone else for taking their time and to actually listen to this presentation. And I hope it makes a lot of sense, and that it becomes fruitful. All the other information can be achieved and be seen from the poster itself and from the article as well. So just to leave you with a quote is that effectiveness without values is a tool without a purpose. And I would like to thank everyone for taking their time. Thank you so much.